Magandang araw sa inyong lahat and welcome to another Concepts in Pediatrics class, and I hope that this is going to be our last topic or last pre-recorded video lecture for this semester. All right, so last time we learned about the different newborn reflexes and how to assess them. And we also learned about the different changes in the skin of the newborn. So we discussed about cyanosis, pallor, anemia, other things like that, including jaundice, hyperbilirubinemia. And so right now we will be continuing with our topic. And this time we will already be learning about the different birthmarks, which are actually variances that we see during the delivery of the newborn. When we do our physical assessment, we will be encountering normal birthmarks that actually do not need any treatment. So number one that we will see on the skin of the newborn is what we call desquamation. It refers to the peeling of the skin, and it is usually observed on the baby's palms or the soles of the foot. It's present at birth, it indicates post-maturity. So nakakakita tayo ng mga pagbabakbak or there is a peeling on the skin, okay? Agla-alat in Ilocano. So that's basically normal. However, when we see these birthmarks, this desquamation on the palms and the soles of the foot of the neonate or the newborn, it means or it goes to show that the newborn is already post-term or post-mature. All right. So the next type of spot or birthmark that we will see is what we call the Mongolian spots. These are bluish to blackish areas of pigmentation and are more commonly noted either at the back, nakikita din siya sa buttocks, upper arm, or the shoulders. They are common amongst dark-skinned individuals. So you expect that if a person is dark-skinned, their newborn or their offsprings will also have plenty of Mongolian spots. Now, these Mongolian spots are actually not permanent because they will disappear at preschool period. Okay? So parang mga balat na malalaki po ang Mongolian spot. The next birthmark or the next thing that we will see on the skin of the newborn is what we call the vernix caseosa. These are cheese-like substances which cover the skin of the newborn, and they are actually a product of sebaceous glands. And we do not remove the vernix caseosa because they can serve as insulators after birth, and they prevent heat loss. Aside from that, research studies have been showing that they also have antibacterial effects, and so they are good to be spread on the skin of the newborn because they also will prevent future infections. So vernix caseosa are not entirely removed, they are just spread evenly towards in the skin. So these are what we call desquamation. Term newborns. These are what we call Mongolian spots, which are bluish black area commonly seen in dark-skinned individuals, and they will disappear during the preschool period. And this is what we call the vernix caseosa. It has insulating effects and also it has antibacterial properties. Now we also have milia. Milia are actually clogged sebaceous glands or clogged oil glands, and they are commonly described as small white pimples that are found on the tip of the nose and chin of the baby. They actually resemble the appearance of whiteheads. Okay. Now these milia disappear after 2 to 4 weeks. And it's very important that we remind the parents to not squeeze the milia or extract it because that will cause infection. So sabihin natin sa mga magulang, ma'am, wag po nating titirisin yung milia because that will cause infection on the skin. So what do we do? Here after 2 to 4 weeks. The next birthmark is what we call the nevi. It is also known as the stork bite or the tassis nevi. They are pink or red flat areas of capillary dilatation that are commonly seen on the upper eyelids. They are seen on the nose, upper lip, lower occiput bone dito po sa likod ng ating ulo, and the nape and the neck. And these appear on the first two years of life. Yung nevi po, para siyang red na balat. Okay? Kaya siya tinawag na stork bite kasi yung stork po, kasla kanaway. Ti kaya na sa dito. Kanaway is a type of bird. Kaslang rod kano na sitok ti bilit DJ nga itsura. No kanya tikita natin na sitok or nakagat ti manok. Kasi ti itsura na DJ nga birthmark. It is flat pink and or reddish in color that are seen on the upper, yung sinabi ko kanina dito, upper eyelids, nose, upper lips, other places. We also have the term Erythema Toxicum. These are actually also known as Erythema neonatorum. They are also called newborn rash or fleabile dermatitis. They are transient rash. Ibig sabihin, they will appear and then they will just go away naturally. Kung nakakakita po kayo ng mga bata na may mga parang mga butlig-butlig dito sa mukha na maliliit, these are what we call papules, okay? Or vesicles that are seen on the nape, on the back, or the buttocks, yung parang rashes na may mga butlig-butlig or raised na papules on the skin that are filled with fluids. Erythema toxicum pa ang tawag natin doon. They appear at the second day of life and they will disappear even without treatment. So hindi po nakakabahala itong mga to because they will eventually go away after a certain period of time. So these are what we call milia. As you can see, they look like little pimples or whiteheads. These are what we call the nevi or the stork bite. So as you can see, they are flat. They are also pink or reddish in color. So yung isa nandun sa occiput or the back of the head. Yung isa naman na sa upper lips. So nawawala yan on the first 2 years of life. And then we also have the erythema toxicum or the fleabile rash or the newborn rash. So nakikita nyo, di ba, mayroon siyang pag-redness and then there are papules or vesicles that are found on the cheek. Pwede din siyang makita sa back or buttocks. But they will disappear even without treatment. Alright? Next is we also have cutis marmorata. Cutis marmorata is the transitory mottling of the newborn skin when exposed to cold. When you say mottling, in Ilocano, we call it agsuput-suput. Okay? So, when the newborn skin is exposed to cold, makakakita tayo ng mga, parang may mga white or parang may mga raised area sa skin nila. Aping ang kaslamit agsuput-suput, so kasla map. It resembles the map on the skin of the newborn. So nagkakaroon sila ng cutis marmorata, especially if they are exposed to cold. But that's just normal. Okay? We also have what we call the strawberry mark or the nevus vascularis. These are the second most common type of capillary hemangioma. Okay? The lesion or the birthmark is elevated. Kumpara po sa nevi kanina na flat lang siya on the skin, parang discoloration lang, dito po sa strawberry mark or the nevus vascularis, these are elevated or sharply demarcated and bright or dark red in color. They also appear as a rough surface swelling on the skin and they will remain until school age or even longer. So kasla that is strawberry dito yung rupa na or the other parts of the body, umuumbok po siya. The skin is raised. Aside from that, meron siyang mga strawberry, parang super visible yung mga pores doon sa may pag-umbok ng parte. Alright? And then we also have the port wine stain or the nevus flammeus. The port wine stain or nevus flammeus is locally called as balat. Okay? They are observed at birth and they are red to purple in color and they do not blanch on pressure. Meaning, pag pinipress natin yung port wine stain, hindi nag-iiba yung kulay. Okay? So that's how we determine that that's port wine stain. Kasi yung ibang redness kasi ng mukha or ng skin, when you press it, it changes in color. Sa port wine stain po, iba. Hindi siya nagbablanch or it does not change in color when it is pressed. Now, will it disappear? The port wine stain is permanent. It will not disappear and it is commonly found on the face. Kaya po siya tinawag na port wine stain kasi yung port wine po is a type of a swine or a pig. Amuyo dagid jay baboy nga labang. Kaslakas jay apo tinagapuan na day nga term nga port wine stain. Alright? And next, we also have the lanugo. Lanugo are actually your fine downy hair that are seen on the shoulders and upper arm and backs, and they usually disappear after 2 weeks. So that is what we call the transitory mottling of the newborn's skin. That's what we call the cutis marmorata. We also have the strawberry mark. Okay? So as you can see, it is raised. Hindi siya flat, di ba? May pag-umbok. It is raised. And then there is a roughness on the surface of the swelling. Strawberry mark ang tawag natin dyan. We also have what we call port wine stain, which are actually what we call the balat, which do not blanch when we press it. And then we also have the lanugo or the fine downy hair, which will also disappear after some time. So those are the examples of these birthmarks. We also have the term skin turgor. When we say skin turgor, it means that the skin is well hydrated and the skin feels resilient. And if the skin fold is grasped between the thumb and the finger, kunwari no ketelem ko madigi skin nga adati na pintas nga skin turgor na, it will feel elastic. And when the skin is released, it falls back to form a smooth surface. So as you can see on the drawing or in the picture, the skin has poor skin turgor. Okay? Skin with decreased turgor remains elevated after being pulled up and released. So when you assess the level of hydration of a patient, it is good that you also pinch the skin gently and then release it. And if it does not bounce back to its original shape or form, that means that there is dehydration because there is poor skin turgor. Nagkakaintindihan po ba? Okay? So when there is poor turgor, it is usually due to malnutrition, difficulty at sucking at birth, therefore hindi siya nakakakain ng mabuti yung newborn, and it will also be caused by certain metabolic disorders. Okay. So ganyan po ang poor skin turgor. Pag pinipinch yung skin and then when you release it, it does not bounce back immediately. Instead, it goes down slowly. Now we also look at the body parts, the specific body parts, so that we will know we will know how to differentiate the normal from the abnormal findings. Okay? Now, always remember that the head of the newborn is disproportionately large. Anong ibig sabihin nito? When we compare the length or the size of the head of the newborn kumpara sa rest of the body part, malaki talaga yung ulo nila. It constitutes 1/4 of the total length of the newborn. Okay? But as you grow older, lumalaki din yung mga different parts of your body, kaya yung adult's head is already 1/8 of the total length. Now, kung tatanungin nyo ako, sir, bakit naman pag pinanganak tayo, mas malaki yung ulo compared to the rest of the body part? We circle back to the theory of growth and development, which says that the growth and development is cephalo-caudal. Una po kasing nagde-develop yung ating ulo compared to the rest of the body part, both sa intrauterine life and extrauterine life. Okay. Now, the forehead of the neonates are usually large and prominent. Okay? Malaki sila and prominent talaga. And the hair is, if the hair is well nourished, it appears full-bodied. Okay? But if the child is preterm or poor yung maternal nutrition niya, that means that the hair appears lifeless and stringy. Okay? So parang yung buhok na nareband ng maraming beses, ganun po siya kalackluster. Okay? But if it is full-bodied, nasileng, and then makapal, that goes to show that the child has been well-nourished intrauterинely. Okay? Now, when we speak about fontanelles, these are spaces or openings where the skull bones join, okay? And they are actually unossified bones. When we say unossified bones, ito po yung mga bones na hindi pa tumigas, okay? So, those are what we call fontanelles. Actually, we have 2 fontanelles. One is in the front, and then the other one is in the back. Pero para sa ating mga adults, wala na tayong mga prominent fontanelles because as we grow older, the unossified bones harden. Tumitigas sila, therefore nawawala din yung ating mga fontanelles. Now, in Ilocano, when we say fontanelles, it means kupu-kupu. Okay? These are the spaces that are found on the forehead. Nakikita din natin dito sa likod. Pero some of our parents or forefathers do not know na meron pang isang kupu-kupu dito sa likod. Ang alam nang nila usually is yung nandito sa harap. Okay? Those are what we call fontanelles. Now, like I said, there are two types of fontanelles. The first one is what we call the anterior fontanelle. And they are formed by forming the two parietal bone. Ito po yung nasa taas, parietal bone natin. And the two frontal bones that we have. So pag pinag-connect natin yon, we will have the shape of a diamond. Okay? So the anterior fontanelle is diamond in shape and it measures 2 to 3 centimeters in width and 3 to 4 centimeters in length. Okay, so medyo malaki po yung anterior fontanelle. It closes by 12 to 18 months or approximately 1 year and 6 months of the newborn or the infant, I should say. Now, the other one is what we call the posterior fontanelle. It is the junction or the meeting point of the parietal bones and the occipital bone. Okay? Now, it is triangle in shape and it measures only 1 centimeter in length. So compared po sa anterior fontanelle, mas maliit po ng dihamak ang posterior fontanelle. That means that it will close faster than the anterior fontanelle. So 1 month and a half, you can expect, or 5 to 7 weeks, you can expect that the posterior fontanelle will already disappear. Now, what's very important about knowing what these fontanelles are is that they can also show us a glimpse of the health status of the child. Remember that if kunwari umuumbok po yung fontanelle ng newborn, it goes to show that there is increased intracranial pressure. Baka may trauma on the head, kaya namamaga po yung brain. Kaya therefore umuumbok yung fontanelle or there is a bulging fontanelle. Or it can also mean hydrocephalus. Okay? So pag meron pong bulging fontanelle si newborn, you immediately report it to the doctor. However, if the fontanelle is depressed, okay, umuumbok palikod, okay, that means that the patient might be suffering from dehydration. Again, you also have to report the condition to the physician. Okay, so those are two fontanelles. Yung una is the harap. It is formed by the parietal and the frontal bones. And then it is diamond in shape and it is 2 to 3 centimeters, 3 to 4 centimeters in height or length, and it closes 1 to 1.5 years. Yung isa naman po is what we call the posterior fontanelle. It is joined by the parietal and the occipital bones, and then it is triangle in shape, and it only measures 1 centimeter in length, which closes 1.5 months. So ito po yung sinasabi natin kanina. So when you look at the picture, yung nasa taas po, that's what we call the frontal bone. Ito po yun. Yan timuging nyo deta. So when you join the two frontal bones, along with the will be forming the anterior fontanelle. But when you join the occipital bone, ito pong nasa likod natin, along with the parietal bones, you will have the posterior fontanelle. Ito naman pong mga linya-linya in between the skull bones, those are what we call suture. So tignan nyo dito sa taas, in between the frontal bone, we have the metopic suture. Dito po. Okay? These are the spaces that join both the frontal bones. Dito naman po sa gitna, we have the parietal suture. Okay? Or what we call the sagittal suture. It fuses both the parietal bones. Dito naman po sa gitna ng frontal bone and the parietal bone, we have the coronal suture. Dito po. And it joins both frontal bones and the sagittal parietal bones, I should say. And then, dito po sa likod, we have the lambdoid suture. The lambdoid suture is the connection between the parietal bones and the occipital bone. So ang tawag natin dito sa nagko-connect ng ating occipital bone and parietal bone is the lambdoid suture. Dito naman po, meron din tayo dito. Ang tawag kasi dito natin is temporal bones. Ang tawag natin doon, dito yung pispis. Okay? Ang tawag natin sa bone dito is the temporal bone and it is connected with the parietal bone. Ang tawag po natin dito is the squamous suture. Okay, so it's good that you know these sutures and the names of the bones because all of them come out in the board exams. So you have to remember them because these are actually important when it comes to the delivery of the newborn because ito pong mga suture na to, they allow the passage of the head of the newborn. Kasi because of them, the head is malleable, flexible po siya, kaya nakakapagpas yung ulo ng bata from the vagina even if the head is larger compared to the vagina. Okay? So yan po yung ating fontanelles along with the cranial bones and the sutures. Now, yaman din lamang na pinag-uusapan na natin kanina yung suture, we discuss them. Okay? Yung sutures po, they are the separating lines of the skull bones which will allow molding. Ito po yon. Yung sinabi ko kanina na yung mga lines in between the cranial bone, that is what we call the suture. Yung space naman po na unossified, those are what we call the fontanelles, yung mga light yellow. Okay. Now, ano bang ibig sabihin kasi ng molding? Pag sinabi natin pong molding, it is the overriding of the bones due to pressure, which is exerted by the passage of the newborn's head in the birth canal. And it is a normal phenomenon. Anong ibig sabihin po nito? Yung ulo kasi ng bata, hindi pa nag-fuse entirely yung kanyang mga cranial bones. Ibig sabihin, pag naa-applyan ng pressure yung ulo ng bata, yung mga mismong cranial bones, nag-a-adjust yan. Okay? And because of the presence of the suture, meron tayong molding na tinatawag. Yung molding po ay nagiging malleable yung ulo, kaya nakakapas siya in the birth canal. Okay? Now, it's normal. Ikunadan ne, ala, nagatidog dita ulo dita ubingin. That's normal. Ang tawag po natin doon ay molding. Okay? And it will own, the newborn's shape of the head will return after a few days. So, babalik din yun sa dati. Normal lang yun. Naipit kasi yung ulo ng bata and hindi pa naman fused bones niya kaya nagiging elongated yung ulo ng bata to let the newborn pass in the birth canal. Yun po yung normal. Pero meron mga abnormal structures din po tayo sa ulo na nakikita natin sa mga newborns. The first one is what we call the caput succedaneum. Okay? The caput succedaneum is the edema of the scalp at the presenting part of the head. Usually, kung ano po yung presenting part ng bata, dun po nagkakaroon ng caput succedaneum. This may involve a wide area of the head and this abnormal structure usually disappears or gets reabsorbed at the third day of life. It needs no treatment and this may also cross the suture line. Anong ibig sabihin nito? Kung wari, yung forehead po, yung presenting part, okay? Now, kaka-IE ng midwife, di ba? Natsasagi po yung ulo ng bata and that can also cause caput succedaneum or edema on the head. Tatta, no nag-caput succedaneum ka, mabalin nga deji yan tibukol na is maramaram deti frontal bones, ngayon adapay tibasit nga parietal bone nga may raman ka deji pinagbukol. Okay? Ngayon no dejay bukol na or the edema or the swelling is localized on one bone alone, that is a different thing. That is already cephal hematoma. Yung cephal hematoma naman, it is a collection of blood in between the periosteum of the skull bone and the bone itself due to pressure at birth. Okay? Now, paano po natin mapag-differentiate yung caput succedaneum sa cephal hematoma? Number one, yung cephal hematoma, it is colored black and blue. Okay? And also, it does not cross the suture line. Kung dito lang may cephal hematoma, dito lang. Haan nga may raman dejayanti, bangir nga tulang because the cephal hematoma is usually localized on one region of the skull bones. Okay po ba? Now, ito po, the doctor may give medications to stop the bleeding in the periosteum of the skull bone. Okay? So ito po yung kailangan ng treatment. So you have to report these abnormal structures to the resident on duty so that they will know the interventions to be given to the patient. Lastly, we have another abnormal structure, which we call craniotapes. The craniotapes are actually localized softening of the cranial bone. Okay? Yung ulo, di ba, usually matigas yan because of the bones. Now, dito po sa craniotapes, these are localized softening of the cranial bones and although nakakatakot siya, it needs no treatment because the condition will correct itself after a few months only. Now, it is caused by the pressure of the maternal pelvis to the fetal skull in utero. Okay? Like I said, normal lang po ito and it will disappear after a few months. Now, let us look at the different examples of these structures that we have discussed a while ago. This is what we call molding. So as you can see, that's the same person, that's the same newborn, pero yung ulo niya elongated sa unang picture because of the presence of the molding. Okay? Kasi kadadaan lang po niya sa vaginal canal. The other one is after 24 hours. So as you can see, nagno-normalize na yung shape ng ulo. Okay. Now, molding, it happens because of the presence of sutures, which will allow the head to pass the vagina during childbirth. We also have the first one, the letter A is caput succedaneum. So as you can see, yung kanyang swelling nagko-cross sa suture line. Nakita nyo yung linya dito sa gitna? That's the suture line, di ba? So nakikita nyo dito sa caput succedaneum, meron siyang edema or swelling, pero dalawa yung bones na kasama. Okay, dalawa yung region na kasama. You have the two frontal areas. Pero pag sinabi nating cephal hematoma, when you look at the color, tignan nyo yung color po ay medyo darkish. Okay, yung color niya. Aside from that, the swelling is localized on one specific skull bone. That is how we determine a caput succedaneum from cephal hematoma. And this is craniotapes. It is also known as the eggshell crackling. Okay? Yung pathognomonic sign po or obvious sign ng craniotapes is the eggshell crackling. And it is seen in craniotapes in rickets or in newborns who have low levels of vitamin D. Okay, so makita yo, napaka-soft ng ulo niya. It's like an eggshell crackling. Okay? Craniotapes pa ang tawag natin dyan. Although it appears scary, it needs no treatment. Next, we look at the eyes of the newborn. The eyes of the newborn are usually tearless. Pag umiiyak po sila, they cry tearlessly. Why? Because they still have immature tear glands or tear ducts or lacrimal glands. So normal lang po yung bata na umiiyak na wala pang luha. The eyes of the newborn will only assume their color on the 3rd month of life. So ang unang color ng mga mata natin, they will start as gray or blue in color, and then as you grow older, pag 3 months of life ka na and beyond, your brown, magiging green, other things like that, other colors like that. Okay? We also have the terms of conjunctival hemorrhage. When we say subconjunctival hemorrhage, it means the rupture of the capillary and the conjunctiva due to pressure at birth. Because of the pressure exerted by the vagina on the head of the newborn, yung mga blood vessels po sa mata natin, pumuputok yan. Pumuputok sila, it will cause bleeding on the sclera, yung puti ng mata. Okay? And that is now what we call the subconjunctival hemorrhage. Usually, they appear as a red dot on the eyes, and they will need no treatment because the bleeding is slight. So, konti lang naman usually yung bleeding na nakikita natin. So, hindi na kailangan ng gamot para doon. We also have the periorbital edema. When we say peri, around, di ba? Around the perimeters. So, periorbital edema around the perimeters of the ball of the eye. Okay? So, dito yan timata, makita tayo kanung adati edema na or swelling. Okay? Parang namamaga yung mata ng bata. Now, periorbital edema is common on the eyes on the second to the third day of life. Now, bakit po nagkakaroon ng periorbital edema yung bata? Because the body of the newborn cannot yet evacuate the excess fluids that it is accumulating. So yung bata inom ng inom, pero yung kidneys niya hindi pa niya kayang ilabas yung mga fluids efficiently. Kaya usually nakikita natin ang periorbital edema on the second to the third day. But sir, normal lang po ba to? Yes, it's normal and it will need no treatment. Hindi kailangan po ng gamot because as long as the newborn will be excreting or urinating already, mawawala din po yung periorbital edema. Now, we also look at the ears of the newborn. We assess the ears of the newborn, and the external ears are not yet completely formed. Okay? The pinna of the ears may also break easily. Unlike para sa atin that the ears are already holding their own shape, okay? Medyo matigas-tigas na. Sa mga newborns po, their ears are not yet completely formed and the pinna breaks easily. Now, anong problema dito? Pag nagbe-bend easily, I should say, yung pinna of the ears. If the newborn will sleep with poor ear alignment, kunwari pag natutulog yung newborn and then higaan niya yung kanyang ear na nag-bend ng ganito, it will assume the position permanently. So pag yung bata, lagi niyang nahihigaan yung kanyang pinna na nagbe-bend, tendency is yung bata po, mas forward po yung kanyang ears pag laki. Inilarang dejay ubing. Alright. Next, we also have to look at the normal ear alignment. Tinitignan kasi natin yung position ng mata ng bata and the ears. Okay? Kasi po, that will already show us chromosomal abnormalities that may be present on the neonate. Okay? Now, always remember that the normal position of the ear should be, the top of the ear should be in level with the outer canthus of the eye. So, no ikastuyo detoy, dapat adati parte na toy alapayag pay nga mabati. Okay? When you form that line in between your eyes, outer canthus of your eyes and your ears, dapat yung topmost part is above that line. Okay? Now, paano naman po yung kung mas mababa yung ears ng bata? We already call that low set ears. And they are usually seen in chromosomal abnormalities. Say for example, Down syndrome. Nakikita na natin yon. Yung mga patients na may mga chromosomal abnormalities, usually talagang mababa po yung kanilang mga ears. Okay? Now, aside from that, we also perform hearing test on the newborn. Okay, so how do we perform the hearing test? Number one that we can do is we will ring a bell 6 inches away from the newborn's ear. If the baby reacts or blinks or kung nagulat siya or the newborn gets startled, there is positive hearing. Pero pag yung bata naman po ay walang reaction, that means that there is negative hearing. So maaaring yung ditong part niya ay hindi nakakarinig, yung isa naman is positive. Pwede din pong mangyari yun. Alright? So let's have a look. This is what we call subconjunctival hemorrhage. Sabi ko kanina, it usually disappears even without treatment. This is periorbital edema. Nangyayari yan because of the difficulty of the kidneys to excrete excess fluid. But as long as the newborn is urinating, mawawala din po yan. We also have the normal ear alignment. Okay? So as you can see, yung mga true low set ears, tignan nyo, di ba? Mukha pa lang is we already are noticing abnormalities just because of looking at the position of the ears. We can already point out na may mga chromosomal abnormalities ngayong potential chromosomal abnormalities ngayong bata. All right. Now, we also look at the nose, assess the nose of the neonate, and then look at the nose because they may also appear large for the face. Sasabihin mo, ala, bakit yung nose ng bata hindi mana sa akin na matangos yung ilong ko? Now, remember that all of the newborns' noses will appear large for the face. Amin tayo, may yanak na dupap. But as we grow older, that's the time that our noses will take. Aside from that, remember that the milia may be appearing on the top of the portion of the nose. So mga parang whiteheads na yung nose ng bata. You tell the parents that it's just normal. Okay? Normal lang po yung milia na nakikita natin. What's abnormal is what we call choanal atresia. Ang choanal atresia po, it's the presence of a blockage at the rear or sa likod ng nose ng bata. On the rear part, di likod, ti abot, ti agong, di ubing, there is a blockage. Now, how do we check for choanal atresia? Kung nandito po yung blockage niya, you check one nares. Okay? I-close mo di mesa nga nares na. No, if there is no reaction from the newborn, that goes to show that there is an opening here. Okay? May opening dito. Pero pag clinose ko po dito, and then yung bata is umiyak, that means that there is a choanal atresia here. Apay. Kasi no in-close mo detoy, tapos sa dapay lang ti blockage na ditoy, banger, haanin nga makaangis ni newborn. So that's how we detect choanal atresia, by closing one of the nares and then assess the newborn. Pag close mo yan, nakakahinga yung bata. That means na walang blockage dito. Pag close mo ulit yung kabila, nakakahinga yung bata. That means wala siyang choanal atresia. Pero pag close mo yung isa, nakakahinga. Close mo yung pangalawa, hindi na siya nakahinga, umiyak na siya. That means merong blockage on that part of the nostril. Now, assess the mouth of the newborn. Remember that the newborn's mouth should open when the baby cries. Wala pa akong nakikitang newborn na umiiyak na mahinhin na gumaganon lang. Dapat the mouth of the newborn should open, actively open when the newborn is crying. Now, you will come across newborns whose mouth movements are a little sketchy or suspicious. Kunwari yung isang side lang ng mouth niya yung gumagalaw while the other does not move, you report that condition immediately to the doctor because that may mean cranial nerve injury or what we call the Bell's palsy. Okay? So pag yung movement ng mukha ng bata ay hindi siya symmetric, yung isa gumagalaw while the other does not move, that means cranial nerve or Bell's palsy. Cranial nerve injury or Bell's palsy. Aside from that, makakakita din tayo on the buccal cavity of the newborn, round glistening cysts. Okay? Parang may mga bukol-bukol na maliliit na nakikita on the mouth of the newborn. Ang tawag po natin dito are Epstein Pearls, and they are actually caused by excessive maternal calcium. Yung nanay na sobrahan ng inom ng gatas or na sobrahan ng inom ng calcium supplements during pregnancy, and because of that, the excess calcium gets deposited on the mouth of the newborn. Normal lang po yan, yung Epstein Pearls. But sometimes parents mistake this for candida infections or singaw or what we call oral thrush. So sabihin nyo lang, mother, wag nyo pong lalagyan ng asin or anything yung mga nakikita nyo na round glistening cyst because these are just Epstein Pearls. Mawawala din po ito even without treatment. Okay, I will show you a picture later on. We also have the term tracheoesophageal fistula. Okay, these are abnormal communications between the trachea and the esophagus. So yung trachea kasi, it is connected to the bronchioles and then pupunta sa lungs. Dito naman po sa esophagus, it is connected from the mouth to the stomach. Pero sometimes, may mga pasyente po tayo na may abnormal structures na nagko-connect sa trachea and the esophagus. And that is what we call the tracheoesophageal fistula. Now, problema po ba ito? Yes, this is a very big problem. The newborn will need surgery because of this. Bakit? Kasi when the newborn swallows, dahil sa presence of fistula, nagko-connect po yung kanyang trachea and esophagus. And because of that, there is a very high risk of aspiration. So maaaring yung mga kinakain ng bata, pumupunta po sa lungs. Maganda po ba yon? Hindi. Okay? So, kailangan i-close yung fistula na yon para yung mga kinakain or iniinom ng newborn na milk will not go to the lungs. Instead, it will go to the stomach. I will show you a picture later on as well. And then, we also have the term natal teeth. Natal means birth, di ba? So, pagkapananganak pa lang ng bata, meron na sila agad ngipin. These are unusual teeth that are usually found at birth. So, sir, normal ba to? Yes, it's normal, but it is not common. Okay? Normal lang po siya, pero hindi lahat ng mga batang pinapanganak ay may natal teeth. So what do we do if we come across newborns who were born with natal teeth? Number one is we check for stability. Tignan po natin kung aglugad-lugad or malapit na siyang matanggal. If it is loose, remove it to prevent aspiration. But if it is sturdy, hindi naman siya loose, do not remove it. Kasi steady naman siya and there is no risk for aspiration, kaya hindi na siya kailangang tanggalin. Okay, let's look at the pictures. This is what we call the choanal atresia. Meron siyang blockage on the rear or the back of the nose. Okay? This is what we call the cranial nerve injury or Bell's palsy. As you can see, there is asymmetrical movement of the face. Yung isa nagdudroop, yung isa gumagalaw. So that's what we call cranial nerve injury or Bell's palsy. We also have Epstein Pearls. As you can see, may mga round glistening white cysts that are seen in the buccal cavity. Normal lang po ito and it is caused by excess maternal calcium. And this is what we call the Tracheal Fistula. Dito po sa left part, nakikita natin yung normal anatomy that the trachea is connected to the lungs and then the esophagus is connected to the stomach. However, in trachea, esophageal esophagus is connected abnormally to the trachea. So, yung esophagus connected siya sa trachea and there's a possibility that the newborn's food goes to the lungs as well. So, that can cause aspiration. Hindi po maganda yon. Okay? And lastly, we have examples of natal teeth. Okay? So, we check for stability. Kung meron ngipin yung bata pag pinanganak, pag loose siya or natatanggal, aspiration. But if it is sturdy, you leave it alone. Huwag mong galawin kung hindi naman kailangang matanggal. Okay? Next, we also look at assess the neck of the newborn. The neck are often short and chubby. Okay, lahat tayo pinapanganak na halos walang leeg at chubby yung leeg natin. What's important to look for in assessing the neck of the newborn is what we call nuchal rigidity. Pag nuchal rigidity po, it is seen on newborns whose membranes were ruptured on the first 24 hours before delivery. Kunwari yung nanay, nagkaroon siya ng premature rupture of membranes. Ang nangyayari po, kunwari, di ba, yung nanay manganganak pa lang. Pero sabi niya, sir, meron na po akong amniotic fluid na lumalabas from my vagina a day ago. So, ibig sabihin, more than 24 hours na siya na merong premature rupture of membrane. Possibility is may mga microorganisms na aakyat from the vagina going to the newborn. Kasi open na po wala na po siyang amniotic sac. Tama po ba? So, yung mga microorganisms na yun, it can infect the newborn's brain. Meninges of the brain. Kaya magkakaroon sila ng meningitis. Sa nuchal rigidity po, there will be problem or there will be discomfort pag binibend natin yung ulo natin forward. Nuchal rigidity ang tawag natin doon. It is usually seen in newborns with meningitis. Narigat na nga itukul na yung ulo da pa, sango. Okay, nuchal rigidity caused by meningitis. Pag sinabi naman nating neck rigidity, it is usually due to the injury of the sternocleidomastoid muscle. Ito po yung mga conditions wherein the newborn will have problems rotating the head. Okay? Noon, dito nuchal rigidity, dito naman po sa ating neck rigidity is mahirap ng ganito, mahirap yung ganon. Okay? Neck rigidity because of the problem on the sternocleidomastoid muscle. Mabalin nga yung muscle niya po dito ay napigtas or na-damage during childbirth. Kasi yung midwife, masyadong malakas siya maghila, pwedeng ma-damage yung muscles dito. Therefore, dito ubing is kastanto titsuranan, marigatan. Sunanton nga mang control the neck na. Okay, the head or the neck cannot rotate freely. It is also known as congenital. This can also be caused by congenital torticollis or baka nayanak di ubing nga kasdi talaga. Or it can also be caused by too much pressure that is exerted on the neck. Okay, na pigsa unay nga guyod ni midwife. So na-damage the sternocleidomastoid na. Okay? Note that some infants most infants I should say, will lag their heads when pulled to sitting position. Laging kunada di kastoy. Bobbing their head. Why? Because they still have poor control on their neck. Kasi nga yung development from cephalocaudal. So, nung marigatan da pa lang ang control, the gianti ulo that means that they are not yet ready to assume the sitting position. Okay? Masyado pang maaga para paupuin yung bata. Okay? The thymus gland of the newborn is slightly prominent. Bakit po? Kailangan pong magiging prominent po yung thymus gland mo because it is active on the first 2 months of life. Bakit? Because of the rapid growth of the thymus gland, kasi kailangan niyang mag-produce ng maraming antibodies on the first 2 months of life habang hinihintay ng bata yung mga bakuna. Okay? So, yung thymus gland niya maaaring prominent din. Normal lang po yun. Okay? Ano pa po? The chest of the newborn may also appear engorged. Ibig sabihin, kaslagpang mukelen nga may yanak dapay lang. That's completely normal. We will also see sometimes patients with thin watery fluids that are secreted by their breasts. Api sir, DJ, sir, bakit po yung nipples ng bata may lumalabas na pong gatas? Normal lang po yun. It's called witch milk to maternal hormones. Okay? The body of the newborn is still affected by the hormones of the mother. Therefore, pati yung katawan ng bata nagpo-produce din ng breast milk because of the presence of oxytocin, progesterone, okay, and other things like that. Okay? So, normal lang po yun. Ang importante is we tell the parents not to extract the witch milk because that can lead to mastitis or infection of the breast. So sabihin natin, ma'am, do not express the baby's milk because it can cause mastitis or infection of the breast. Okay, let's have a look at the pictures. The neck. Ang tawag po natin, it is usually seen in patients with meningitis. At bakit nagkaka-meningitis yung mga newborns? Usually, meningitis is seen on patients whose mothers had premature rupture of membrane for more than 24 hours. Sternocleidomastoid damage naman ang cause ng neck rigidity. Okay? Ano pa? Yung thymus gland is prominent at birth because it needs to work hard in order to produce the antibodies necessary for the protection of the newborn against childhood illnesses. Okay? And lastly, ang tawag natin dito is witch milk. Okay? It is caused by excess maternal hormones. Kaya po yung bata, there is the presence of breast milk on the newborn. So nakita nyo, engorged yung breast ng bata and then meron ding lumalabas. Is this normal? Yes, this is definitely normal. Okay. The chest of the newborn should be symmetric. Ibig sabihin pantay. Pantay yung left and right. If you see lumps on the clavicle, may mga bukol-bukol po dito sa bone dito, which we call clavicle, that may be indicative of a presence of fracture, which have occurred during delivery. Again, hindi lang po kasi yung sternocleidomastoid muscle ang pwedeng ma-damage, pwede ding ma-fracture natin na mga midwives yung clavicle ng bata. So if there are lumps on the clavicle of the newborn, that means that there has been a fracture during delivery. Now, the normal respiratory rate is 30 to 60 cycles per minute. Okay? And when the newborn inhales, dapat walang retraction. When we say retraction, the chest walls are drawn inside during inspiration. No, aganges da, maguyod da di chest walls da. That is not a normal finding. Abnormal po yan. It indicates difficulty of breathing because the newborn is exerting too much force in pulling in air. Dapat no makaagangis na ubing, ganun lang. Awan, walang retraction, handang aguyuden the chest wall da. But if they have difficulty of breathing, minsan ine-exertan nila yung effort yung kanilang pag-inhale na napupull inside yung kanilang mga chest walls. So retraction po ang tawag natin doon. Now, we have rhonchi or the harsh sound of air passing over mucus. Normal lang po na marinig natin ang rhonchi sa mga newborns, especially in the first 24 hours, because this sound is caused by the presence of secretions on the back of the throat. Di ba? Merong mga presence of secretions pa lang sa respiratory system ng bata. Okay? Hindi pa niya natanggal lahat yon. Now, when there is air that passes over these mucus secretions, maproproduce po yung rhonchi. That's normal on the first 24 hours. Ang abnormal po is what we call grunting, and it suggests respiratory distress syndrome. Usually, ang magkasama po ay retraction and grunting. So, makita yung chest walls na may indrawing po. Okay? Pumapaloob yung chest niya pag nag-i-inhale yung bata and nakakarinig din tayo ng grunting. For you to be able to appreciate these adventitious sounds, I suggest that you also log on to YouTube and then type in rhonchi and grunting so that you will know how to tell the difference of these adventitious sounds. Okay. So, tawag natin po dito is lumps on the clavicle. These may be indicative of fractures that happens during delivery. So, makita nyo may bukol-bukol po doon sa clavicular area ng bata. Okay? This is what we call the retraction. So, makita nyo, agpauneg, dejayanti, intercostal area na. In between the ribs, maguyod pa yung chest wall. That's letter A. Okay? And then, clavicular punadan sa dito pati digianti clavicles nagpauneg pa yan digianti ganges dijay ubing. So letter C is what we call substernal. Okay, substernal. Ang letter B hindi ko lang maalala kung ano yan. So again, as you can see, while the newborn is inhaling, guyuden na pay dagitang area. Retraction po ang tawag natin doon. Those indicate a difficulty of breathing. Okay, so report immediately pag nakikita nyo po yung mga ganyang instances sa isang newborn na humihinga. Okay? The shape of the abdomen is usually dome. Okay, pabilog dapat siya. But if there is sunken abdomen, that means that there are missing abdominal organs. So makita nyo dito sa picture po, may missing abdominal organ yan. That may be caused by diaphragmatic hernia. When we say peristaltic sounds, these are sounds that are produced by the intestines and it is heard within the first hour after delivery. Yung peristaltic sound po, in Ilocano, guruod chan mo because of mabisin ka. Okay? That is also a sign of hunger. That means that if there is peristaltic sound, the newborn is now ready to feed or breastfeed. So, peristaltic sound, guruod ti chan, kung nandiyan. Okay, the umbilicus, on the first 24 hours, it will appear with gelatin. It is covered with the Wharton's jelly, and it will also have red and blue streaks, which we call the ava or the, no, hindi siya tinatawag na ava. Yung red and blue streaks niya, it is caused by the ava or the two arteries and the vein. Okay? You inspect the clamp if it is secured. Okay? Pag meron siyang bleeding, you can put another umbilical clamp below the original clamp that is placed on the newborn's umbilicus. Ang color niya dapat is blackish, darkish to color gray-black. Okay? And the stump breaks free after 7 to 10 days. Now, if there is, like I said, bleeding on the cord site, pwedeng it is because of a loose cord or tug cord. Ang pwede natin gawin is lagyan lang ulit natin siya ng cord tie or cord clamp below the original umbilical clamp. Kaya po tayo naglalagay ng 1 to 1.5 inches of allowance pag naglalagay tayo ng umbilical clamp para just in case mag-bleeding, meron ulit tayong space kung saan natin ilalagay yung second na cord clamp. Entiendes? Okay. Now, if there is moist, odorous cord that already suggests infection of the cord. So, you suspect for septicemia. Pwedeng maging kumalat na yung infection pwedeng kumalat yung infection pag hindi nyo report yan immediately. If there is moist, mamasa-masa, odorous, or mabaho na cord, that suggests infection. You tell the parents not to put buttons, coins, tapes on the stump because all of these can cause infection. Anong pwedeng gawin? Air dry the cord as much as possible. Okay, that's how an infected cord looks like. So makita nyo, meron siyang discharges, mamasa-masa. Okay. I'm sure odorous din yan or may fishy smell. And we also talk about the anogenital area. The anus, when you assess the anus, the temperature is taken usually via a rectal thermometer to check for anal patency. Yun yung dating ginagawan natin to check kung meron bang opening sa may anus ng bata. But this is already contradicted by other scientists or researchers. Kasi sabi nila, hindi na po kailangang maglagay ng rectal thermometer sa anus ng bata just to check for anal patency. Ang maganda daw gawin is to check for imperforate anus is just wait 24 hours. Wait for 24 hours. If the meconium passes or timakidijubing, that means that there is a presence of the opening. Pero pag wala daw meconium na lumabas on the first 24 hours, that means imperforate anus or the stenosis or membrane formation in the anus or the absence of the orifice or opening in the anal region. Okay, so kasi kano ti pamayan tayo. Instead of inserting a thermometer sa anus ng bata to check for anal patency, hindi na po daw kailangan yon. What we do is we wait for 24 hours for the meconium to pass. Okay? Pag may meconium na lumabas, that means there is anal patency. Pero pag walang meconium na lumabas on the first 24 hours, that means imperforate anus. Okay. Now, when we look at the genital area of the males, the scrotum is usually edematous and rugated. Okay? Rugate ang tawag natin pag maraming skin folds, like your elbows. Rugated po yung elbow natin. Okay? Yung scrotum is the lateg. Okay? It is the sac which covers the testicles. The scrotum is edematous, rugated, kaslasiko, and then it is deeply pigmented in either black or violet. It's normal po to see newborns whose male genitalia or whose scrotum are dark in color. Normal lang po yan. Okay? There is the term which we call Kryptorquidism. This means undescended testicles. Alam niyo po ba na lahat tayo, when we are inside the womb of our parents, nade-decide lamang po yung ating mga sex if we are already 12 weeks and beyond. Doon nagse-separate na yung sexual organs natin. Anong ibig sabihin nito? Lahat kasi tayo may mga X chromosome. Pag babae ka, XX. Mayroon kang dalawang female chromosome. Pag lalaki ka, may XY chromosome ka. So meaning may part sa'yo na babae pa rin. Okay? So we all start as females and then tignan nyo, di ba? Women have 2 ovaries and also men has 2 testicles. Females, meron silang clitoris, which is the center for pleasure. Sa mga lalaki naman, meron silang clitoris yung females, di ba? Sa mga lalaki naman, meron silang glans penis. So as you can see, may yung corpus cavernosum mo sa penis and sa corpus spongiosum mo, para din siyang labia majora and labia minora. I will show you a picture later on. Okay? So now, in the Kryptorquidism, ang ibig sabihin nito, yung bata, yung testicles niya is hindi siya descended. Okay? So like I said, nagsistart kasi tayo as females lahat. I'll just show you picture later on para mas maintindihan nating mabuti. Aside from that, we also have cremasteric reflex. Paano natin ginagawa yung cremasteric reflex? The internal side of the thigh, the gisel lang na giubing, is we stroke it. The testicles will move upward as a result of that stimulation. That means that there is integrity of the spinal nerve pag presence po yung cremasteric reflex. Okay. This is on the left, you see the normal anatomy. So you can see the small intestine and the large intestines will have an anal opening. Okay, connected po siya doon sa rectum, and then the anus may opening po dyan. But in imperforate anus po, in the rectum, hindi po siya nagjo-join sa anus. So wala pong labasan yung feces ng bata. So imperforate anus. So ibig sabihin daw, if the meconium did not pass on the first 24 hours of life, that means that there is imperforate anus. Now, ito yung sinasabi ko kanina. On the left picture is the undescended testicle or the Kryptorquidism. Okay? And then yung isa naman yung descended testicle niya, doon yung pwesto niya. Like I said, yung nagsa-start lahat ng testicles natin dito sa abdominal area. So ano pa yung nandun sa abdominal area? Yung ovaries. Di ba? So as your body transforms into a male, kasi di ba nagsa-start tayo lahat bilang babae, and then magta-transform tayo into males, yung organ na yon, which is supposed to become the ovary, it will descend, agpababadeta, until it reaches the scrotum. And yun yung magiging testicles. So as you can see, there are different types of Kryptorquidism. May abdominal Kryptorquidism. Adami jita duma mas stuck da di inguinal area. Adami jita duma may stuck di penile region. Adagi femoral region. So suprascrotal area. So as you can see, lahat ng mga passageway or lahat ng mga madadaanan ng testicles, pwedeng ma-stuck doon, and it can cause Kryptorquidism. So makita nyo pa yan from that, yung pathway na dadaanan ng testicles papunta sa scrotum. Okay? So Kryptorquidism ang tawag po noon doon. So, ito naman, tinatawag po natin itong cremasteric reflex. When we stroke the thigh of the newborn, yung testicle po sa part kung saan malapit yung ini-stroke natin, mag-move upward yan. So, sir, is it present in adult patients? Yes. If you try it on your husband or your boyfriend, pag tinistroke nyo yung inner thigh niya, tataas din po yung kanilang testicles. It goes to show that there is in spinal cord integrity pag tumataas po yung testicles niya if you stroke that person on their inner aspect of the thigh. Digisel lang na, apro-apurusan nyo, kita nyo kig pangato jay lating. Okay. The penis of the newborn. The penis will appear small and it is usually 2 centimeters in length. The urethral meatus or the opening of the penis should be on the tip of the glans penis. In Ilocano, di ulo-ulo tibuto na, di dapat di opening of the urethral meatus. Okay? May mga conditions kasi that the patient will have epispadias or the meatus is on the ventral surface. Sorry, paki-change po yan. It's in the ventral surface or di ngatu, di ulo-ulo. Okay? It's on the upper part of the glans penis, yung urethral meatus. Meron din po tayong hypospadias wherein the meatus is on the dorsal surface or sa baba na parte ng penis. Okay? Meron din tayong tinatawag na phimosis. Don't worry, I'll show you pictures later on. You will understand them better. Meron din tayong tinatawag na phimosis. Pag sinabi nating phimosis, there is adhesion of the foreskin on the glans penis. Kaya nasawin, nakapet. When you say foreskin, iso di supot tibuto. Okay? No nakapet unay gaminde jayanti foreskin in the glans penis, it will impede the urination. Marigatan nga umisbo di ubing. Okay? No nakapet unay di supot na. So what do we do? Circumcision is usually done if phimosis impedes urination of the child. Okay. For female genitalia naman, it's normal that the vulva may appear swollen. Kasla, agkabkabibaw, normal lang po yan. Secretion of blood-tinged mucus, normal lang po yan. Ang tawag natin doon is pseudomenstruation. The patient may be still under the influence of maternal hormones. Kaya pati siya, nagkakaroon din ng menstruation. So normal lang po makakita tayo ng mga blood-tinged mucus kasi nga yung mga female newborns may also be under the influence of the hormones of the mother. Okay. So ito po yung normal sa left. You see the normal Urinary meatus, ganyan po dapat kalaki. Pero pag sobrang liit po, ang tawag natin dyan is meatal stenosis. Mahihirapang umihi yung bata kung ganyan kaliliit yung kanilang urinary meatus. Again, pag hypospadias, pag normal na placement po ng urinary meatus, it should be on the tip of the glans penis. But for patients with hypospadias, kitain nyo, it is below the opening. Okay, the opening is below the tip of the glans penis. Pag epispadias naman po, the opening is above the glans penis. So makita nyo po, iba po yung alignment niya. So usually, it is corrected by surgery. Mahihirapan kasing umihi yung patient or magbuntis yung mga asawa nila if they grow up with that kind of meatus. Kasi nga, yung tip ng ulo is hindi naman makakadaan yung mga sperm doon. So it will need surgical correction. Okay? So ito yung sinasabi ko kanina. At 12 weeks of life, nagiging nagdedetermine na ng katawan natin kung magiging babae tayo or lalaki. On 6 weeks of life, we're either boys or girls. And then pag 12 weeks, so magpo-fuse na yon, and then magiging lalaki ka, magpo-form na siya into glans penis, yung clitoris mo dapat, and other things like that. Pag babae naman, bubuka ng bubuka yan until the vagina, labia majora and minora will be formed, and then the clitoris will also be formed. So makita nyo yung placement parehong-pareho, no? Okay. So like I said, lahat tayo pinapanganak na may X chromosome. So lahat tayo may mga genes sa atin na kalahating babae. Okay? And then the back of the newborn. When you assess the back of the newborn, they should lie on flat when supine. So nung nakaidada, flat di yan tibukot da. The spinal curvatures will only appear when the child will start to sit. Ang sabi ang spinal curvature is yung likod natin, magkakaroon na siya ng letter S. Okay? Mag-a-appear lang yon, yung curvatures na yon, when the newborn is already sitting. An infant who will assume their position in utero. So ibig sabihin, the back of the newborn will be rounded and then naka-flex suna on the abdomen and the chest. Ang tawag po natin doon is fetal position. That's normally seen on neonates because they will assume their position in utero, and that position also helps to prevent heat loss. Dapat, the back should be smooth. But if there is a presence of mass or buccal, hairy nodules, or dimpling, this may indicate spina bifida, which is an abnormality on the spinal column. Pag nakakita kayo ng buccal, hairy nodules, or dimpling on the back of the newborn, report immediately to the doctor because that may be indicative of spina bifida. The extremities of the newborn should be symmetric. Kung gaano kahaba yung left, ganon din kahaba yung right. So, equal length. And they should also move in coordination. Pag dapat gumagalaw yung isa, nakakagalaw din yung isang kamay or isang paa. Now, like I said, the arms of the newborn will assume a flexed position while their feet are bowed. Usually, yung mga iba nakakayang da, kasla bow, when para pana. Okay. Ay mo yung itsura ti pana? Bowed. Ganun po yung itsura ng kanilang mga paa. Okay. Meron tayong tinatawag na polydactylism or extra digits. Some of the newborns will have extra digits. 5 yung fingers nila yung sa isang kamay, 6 or 7 sa isa. So, polydactylism ang tawag natin doon. Syndactylism naman po ang tawag natin pag may fusing of fingers or digits. And then, Simian Crease is usually seen in Down syndrome patients. So, yung Simian Crease po, it is a single crease that are found on the palms of the newborn. Okay? Dapat 3 yung nakikita natin na palm, na crease dito sa kamay. Pero pag may Simian Crease ka, meron ka lang isa and straight pa yon. Okay? We also have the Abduction Paralysis. It is the inability to move the upper extremity due to nerve damage during delivery. Okay? Bakit? Kasi pag pinanganak yung bata, pag na-deliver na yung ulo, and then the midwife will use the armpits, the kilikiliti, pangguyudan da di ubing no irwarda, that can damage the nerve on the armpits during delivery. Therefore, no madamage da yan nerve ditoy, marigatan to ang mga control DJ, ima DJ, ubingen. Ang tawag natin doon is Abduction Paralysis. Okay, let's have a look. Pag may dimpling, mass, or hairy nodules, It can be spina bifida. Okay. Polydactylism naman ang tawag natin dito. May preaxial or radial, so duwati tangan na. May post-axial duwati hikit na, or central, or adadu dagitoy dito yan titeng nga fingers na. Ang tawag naman natin dito is incomplete syndactyl, fused fingers, pero incomplete, nagdikit da, but there is an area nga handapin nga nagdikit nga na siya, at complete syndactyl naman pag yung fingers are completely joined with each other. Even the nails, kita nyo kinagtipon da. Okay? So that's what you call polydactylism and syndactylism. Okay? Ang tawag naman po natin dito is the Simian Crease or the Simian line. Normally, we have at least 2 to 3 palms on the creases on our palms. Pero if the newborn will have single palmar crease or may Simian crease siya, that goes to show that there is a possible chromosomal abnormality. And lastly, Abduction Paralysis po ang tawag natin dito. Okay? So makita yo yung single because of the ineffective technique used by the midwife to deliver the newborn. Dapat neck lang po yung ginagalaw natin and then we pull the newborn by the neck. Yung mga iba kasi, ang ginagawa nila, pagkalabas ng ulo, dinedeliver yung upper shoulder. Pag lumabas na yung shoulder, i-jaimit din tipagigamandan. Hindi po pwede yon. That can cause Abduction paralysis. Alright? I guess that ends my discussion. Maraming salamat po for attending my classes during this semester, and I appreciate so much your time and patience when it comes to attending my classes. Again, thank you so much. Have a great semester, second semester ahead. This is Dr. Jeffrey Reboron, signing off.